Once psychoeducation or learning more about how ADHD impacts them in different domains is completed, and once we start addressing um, some of the agenda items of the child and the parents, what it looks like about 5 6 months down the road is that there's some long-standing difficulties with ADHD, like not being able to be consistent, or despite all efforts, these things still happening. Those start to emerge, and it's a very important time in therapy, because then the child realizes that, and the parents realize that, while we can master, understand, and maybe strategize ADHD away, we eventually will have to manage it. That eventually we'll have to go with the flow, that as compared to other people, I will be forgetful. I might need more reminders. And despite all of that, there will be mishaps. And accepting that is stage two of the therapy. Stage three of the therapy eventually is towards the end, as we are wrapping up, is that let's use a strength based approach. These are my areas of difficulties, right? I've tried to fix it with therapy, maybe with medications. Still, these things slip away. I'm accepting that these things will continue to happen at some rate. But then the strength-based approach says, I am a spontaneous person. I do things chaotically. I need to I need to do a little bit to organize myself, but I will thrive when I am true to who I am and not try to conform too much. So if all your bright ideas are coming between 12 a.m. and 3 a.m., sure, that's what you do, but at least now you're doing it with a sense of awareness, and you are protective of your sleep, and you have done this after acceptance, and not as a defense or as defiance, that I don't care why people study and or are able to sleep at a certain time. I can't do it and I won't do it. The internal voice says that because pressure is where I perform best, I'm unable to sit at 6 p.m. like other kids. So I've tried and sometimes I fail, and it's okay to go back to how I was built, even if it doesn't seem very pretty. I at least get the job done. So in the end, it is basically accepting and managing the ADD, but using the strategies learned during stage one and two, and the acceptance gained during step one and two, that sort of are able to moderate the full impact of ADD by giving strategies as well as that.